We're now going to switch to the Flint team, and now we're moving on to when you're in treatment. And it's not by happenstance I'm torturing Dr. Ye to lend a hand today, because he sits at one of our most prestigious locations, which is the Proton Center. So last year we were here learning all about proton therapy, and you're very much invested in all of that. But when you're in treatment, it's sometimes more than just that. You get sort of ideas of, wow, I'm really fighting this, is what Bill was saying, and I'm gonna start my own foundation, my own fundraiser. Maybe I'm going to go out there and do something like a race. Maybe there are other things you want to try to work with and volunteer in different organizations. So I think here Dr. Ye will lead us into when you're in treatment, what else should you be thinking about? So Dr. Ye, you've got the platform.
Thank you very much, Dr. Heath and all the organizers of this symposium. I think this is very important. I think as Dr. Robinette alluded to, cancer is becoming a very common disease, and so I think it's very important that just people know more about it. And so today I'm going to talk a little more about what treatment is like, and then also along with Megan Landry from the American Cancer Society, as well as Doug Glazier from the McLaren Flint Foundation, we'll talk about what resources are available for patients to help them while they're undergoing treatment. I apologize. I did make some slides. I wasn't sure what I should do, so I just made some slides just to go over what treatment is like, and then talk a little about, because I'm a radiation oncologist, talk about what radiation therapy is like and what we have here in Flint. So do you mind showing my slides, please? So my name is Brian Ye. I'm one of the radiation oncologists working at McLaren in Flint. I work at both the Karmanos Cancer Institute as well as the McLaren Proton Therapy Center. So I just want to talk a little about sort of what treatment is like. So I was going to talk about an overview of cancer treatment, as well as something that I have sort of an interest in, something called proton therapy, and then something that we're actually developing here in Flint, which is treating patients with proton therapy in a seated position instead of lying down. And so I'll talk about that towards the end of my talk. I'll make it very brief, and then I'll also, after I'm done with my slides, I'll open up to Megan Landry from the American Cancer Society, as well as Doug Glazier from the McLaren Flint Foundation. They'll talk about how they support cancer patients while they're on treatment. So just really briefly about treatment. I'm sorry, can you go back to the slides? So cancer treatment usually composes many specialties, and they include, surgeons, medical oncologists, radiologists like Dr. Dr. Robinette alluded to earlier today, as well as radiation oncologists like myself. Surgeons, usually do surgery, but they also sometimes they're needed to do what we call something called vascular access. For example, it's placing a port through which we can administer chemotherapy. Medical oncologists, they administer chemotherapy as well as targeted therapy and immunotherapy. Radiologists, as Dr. Robin alluded to, do a wide variety of treatments, including cryotherapy, radiofrequency ablation, radioembolization, chemoembolization. Sometimes they're also involved in vascular access, so that patients can receive chemotherapy. I'm a radiation oncologist. Patients sometimes need X-ray therapy, which is a type of radiation therapy, or brachytherapy, which is a type of radiation therapy. We bring the radiation therapy a little bit closer to their bodies, the source a little bit closer to their bodies. We also sometimes administer radiopharmaceuticals, which are medications that actually are radioactive. And then we also sometimes use proton therapy, which I'll talk about a little bit more at depth. So I'll just talk a little more radiation therapy in general. This is just a picture of a X-ray therapy machine. It's called a linear accelerator. There's a table, it's that black table in the middle. The patient lies down on that table, and then the machine delivers the radiation therapy. There's another type of radiation therapy called brachytherapy. This is an example of that. This is a device that I put near where the tumor is, the cancer is, and then you can see there's a little bit of a metal straw that goes from that half cylinder. I then insert a radioactive seed at the end of a wire into that metal straw. It delivers the radiation therapy source at that area for anywhere from a few minutes to maybe 10 minutes or so, and then we're done. It's called brachytherapy because brachy means close. So it's a type of therapy where I bring the radiation therapy source close to the patient. This is an example we use for skin cancer. So we can treat skin cancers with brachytherapy, and we do that here in Flint. Now we'll talk about something called proton therapy. Proton therapy is a newer, sort of more focused form of radiation therapy, and this is just a graph. On the bottom, on the x-axis, is what we call penetration depth. This is how deep the radiation is being delivered in the patient's body. And then sort of on the y-axis from 0 to 100%, sort of how much dose is being delivered. And you can see in gray, that graph is how X-rays work. And if you can imagine, there's this area around 20 centimeters at depth, there's a tumor there. You can see how X-rays, they actually go through the body. They enter the body, they treat the tumor, then they go out the body. So there's both what we call entry dose, dose that's delivered to normal tissue before the tumor, as well as dose that's delivered after the tumor. Now, protons are a little bit different. Protons actually stop. So I told my patients it's like a marble traveling in water. As it goes through the water, it starts to slow down, eventually it stops. And so in orange, there's the dose distribution for protons. You can see how it just stops. So the great advantage of protons is they enter the body, they slow down, eventually they stop. And I can adjust how far they go by adjusting the speed. So if the protons are going faster, they go deeper into the body. If protons go more slowly, they go to a more shallow depth. And the real advantage of protons is you can see at the far end of the tumor, there's no exit dose. So protons are a little bit more focused. This is just a graph showing the different speeds, or we call them energies. I can deliver the protons and how, so each colored little graph is a different speed of protons and it can go different. So by adjusting the speed of my protons, I can adjust how far they go on the human body and I can make sure that they're more focused. I can make sure I treat the tumor and nothing beyond it. There's still entry dose, so protons are not perfect. So I still have to deliver some radiation dose to normal tissue, but it's less than X-ray therapy. This is just a big sort of diagram of the McLaren proton. It's like a blueprint, like a floor plan of the McLaren Proton Therapy Center. Over on the left, you can see this little circle. It's called the accelerator. What happens is we take hydrogen gas, we take out the electron. Hydrogen is one electron and one proton. So I remove the electron and I can accelerate that proton using magnets. And they go in a circle until they reach the speed or the energy that I need them to be. And then I can direct them into these, well, we currently only have 2 treatment rooms open. But I can then deliver the protons into one of 3 treatment rooms. The 3rd room is still under construction, but we have 2 rooms open right now at the Proton Therapy Center. This is sort of it's just a quick sort of floor plan of our center. This is just a picture of the accelerator system. There's this thing called the Linux injector. That's to get the protons just going to enough speed so they can start going in the circle. And the synchrotron is the circle. So it looks like a little circle. And they go in that circle. And each time they go through the circle, I make them go faster and faster until they reach the speed that I need. And then they're delivered to the patient. Now, the thing about protons is they travel typically around 2/3 the speed of light. I mean, depending on, and that's very fast. It's like a race car. And just like a race car can't make a sharp turn. To turn the electrons, to turn the protons, I need to bend them very gently. And so this is actually a picture of the device that bends them. It's called a gantry. And there's a person there. You can see there's a person right at the bottom. It's a 3-story high gantry. It's about 40 feet wide and it weighs about 190 pounds. It's very heavy. It's expensive to build. But it allows us to bend the proton so I can direct it from the direction that I need to treat it from. Because obviously I need to then direct the proton, and the patient actually stays right in the middle. There's a little circle in the middle, and that's where the patient is. And that the magnets are the red parts, and they bend the magnets. And this is what the patient sees. It's just a little room with a table, just like with the X-ray machine. And then where it says the nozzle snout, that's where the protons come out. And the patient just lies there and is treated with the protons. Currently, there are about 40 proton centers around the country. We're fortunate to have one here in Flint. There's 2 in the state of Michigan. You can see here there's one. In our closest proton centers, there's 2 in Ohio and 1 in Illinois. But there's 2 in the state of Michigan, and we have 1 here in Flint. And this is just a quick picture of showing comparing X-rays and protons. You can see on the left, there's a picture of a patient being treated with, well, this is actually the same patient. This patient was treated with proton therapy, but I created an X-ray plan for comparison. And the color levels are where the radiation is being delivered. And you can see here on the left-hand side, the X-ray therapy, there is radiation dose going to other parts of the brain. This is a patient with a brain tumor. On the right, you can see the proton is much more focused, and there's parts of the brain that get no radiation. This is an example of treating proton therapy with, treating lung cancer with proton therapy. On the top is proton therapy, on the bottom is IMRT. Again, this is the same patient. Patient's treated with proton therapy. We just created an IMRT, which is an X-ray, which is a form of X-ray therapy. So on the bottom is X-ray therapy, or another name, so it's also called IMRT. On top is proton therapy. And you can see it's just a lot more focused. This is a patient with esophageal cancer. On the left is IMRT or X-ray therapy. In the middle is protons. And you can see here there's less radiation dose going to other parts of the body. And actually on the bottom left, this is just a different, it's called a sagittal view. It's a different view. And you can see in the yellow dotted line is the heart. And this is to show that the heart gets a lot less radiation with proton therapy as compared to IMRT. Now, one of the issues with proton therapy is that the gantry is very expensive. And another way to deliver radiation from different angles is to rotate the patient instead of rotating the protons. And that basically, there's a company called Leo Cancer Care that's they're inventing a chair, they're developing a chair. And we actually here in Flint will be the first site in the United States to have this chair. There's currently another center in France that's also working on developing the chair with Leo Cancer Care as well. We'll be the first site in the United States to have this. This has multiple advantages, not just from the fact that it's potentially less expensive. One of the issues with proton therapy is that sometimes it's not covered by insurance because it's a little bit more expensive than X-ray therapy. So this has the potential to reduce the cost of proton therapy, to make it more affordable, but also the potential to increase patient comfort because sometimes patients, it's not comfortable or it's not comfortable for patients to lie down flat for treatment. This chair can potentially allow patients to be treated in a seated position so that they can be treated in a more comfortable position. So here you can see there's a picture of the chair. It's that black thing in the middle. On the right-hand side, that's just a CT scanner. And that's just the CT donut. So we can do a CT while the patient's in the chair. And these are different positions that patients can be in while they're being treated. For example, on the left here, you can see if we were treating prostate cancer, patients would be in that position potentially and have their arms up out of the way of the beams. If we're treating something within the lungs, that'd be the second figure you see there, and have the arms up again to get out of the way of the lungs. Treating breast cancer, we're having a little bit forward to have the breast maybe get away from the body a little bit more so we can treat the breast without having to treat other parts of the body. And then, of course, if we're treating the head or neck region, then we'll have the arms down. So if you treat a patient with a brain tumor or head and neck cancer. And so this is just another picture of showing if we're treating patients in the head and neck region, and this is a doctor in France, just sort of testing it out there, how it would be. Just a picture showing how how the patients could be seated there comfortably. We're currently in the process of working with Leo Cancer Care to build a prototype of this chair right here in Flint, and we're hoping to maybe be able to treat our first patient hopefully sometime next year. And this is just an example of how we would potentially treat a patient with breast cancer. Again, just showing there's a person there. And this is a lot more comfortable than leaning on your back. And so we're hoping that this could help not only decrease the cost, but also increase the comfort of patients. So just in summary, just while you're in treatment, cancer treatment can involve many different medical specialties, including surgeons, medical oncologists, radiologists, and radiation oncologists. Then, because I'm a radiation oncologist, we just want to talk a little bit about proton therapy. Protons are a bit more focused than X-rays. As a result, protons have the potential to treat certain tumors with potentially less normal tissue damage and fewer side effects. And this treatment chair that we're developing in collaboration with Leo Cancer Care has potential to increase patient comfort as well as to decrease the cost of proton therapy. So thank you very much for your attention. If you don't mind, I'll just turn it over to both Megan Landry from the American Cancer Society, as well as Doug Glazier from the McLaren Flint Foundation. They'll talk about a little bit how they support patients while they're on treatment, and then we'll open up to questions.
All right. So hi, everybody. My name is Megan Landry. I am the Associate Director of Cancer Center Partnerships, which is a very fancy way of saying that I work with the cancer centers in Michigan and Indiana on screening and prevention interventions, but also supporting cancer patients at those cancer centers. I want to give the caveat that I am not going to say absolutely everything the American Cancer Society does, because we would be here for a very long time, from our research that we fund to provider education. So I'm really here to focus on how we can support patients and caregivers, because caregivers are just as important during cancer treatment. So the first thing I want to share is that we have a 24/7 phone number that somebody live answers. So if you at 3 a.m. have a question about cancer, you can call our number and somebody will answer the phone and talk to you live. I'm going to give that number out, so get your pens ready. It is 800-227-2345. So our staff that answer the phone are trained in how to answer those questions. They can, if you're looking for an online support or a virtual support group or an in-person, they can take your zip code and find an in-person support group near you. With that number, we also have oncology nurses who can answer more medically complex questions, and even some who are more focused on pediatric oncology. The second thing, so we've talked a lot about today, is finding credible information. That's kind of a theme that I've heard. So our website is available. It's cancer.org. It is evidence-based and accurate information. We have medical professionals on our team who update the information on our website. I just want to share that our whole executive leadership team, even our CEO, are oncologists or scientific researchers in the field of cancer. So they're really dedicated to making sure that the general public has accurate information. You can find a lot on our website. There's an anatomy gallery, so you can look up pictures of what does it even mean to have cancer in this type of my body. There's videos. There's a personal health manager kit that used to be something we could give out at cancer centers, but in the virtual world, it's more virtual. So you can print off a sheet to keep track of your medication, questions to ask your doctor, and specific information about your cancer diagnosis. A few of the other things that I just want to make sure I share are our Road to Recovery program. So that's a program where volunteers drive patients to treatment if they need a ride, which I think somebody mentioned is one of the #1 barriers. So often people need a ride to treatment either because they don't have a car or they have family members that can't drive them because they have to work. I will say that we really need volunteer drivers to make this program work. Right now, we're only able to fill about 38% of the requests that come in because we don't have enough volunteers. So if you're interested, you can visit our website to sign up to drive. We especially need drivers in Flint and in Detroit. We also have a Reach to Recovery program. So that's for women who are newly diagnosed with breast cancer can talk to a breast cancer survivor and just get that one-on-one peer support. And as of September, we've launched an app. It's called ACS Cares. It's available in Apple and Google, and it gives you tailored information to you. So I can type in, I'm a 36-year-old woman who was diagnosed with stage 3 breast cancer, and I live in Michigan, and it will give you specific information for you and your diagnosis. We are piloting a program on that app where you can talk to other survivors about your diagnosis. So I'll stop there because I know we're going to ask some questions too, but those are just a few of the things that I wanted to make sure that I shared.
Thank you. Good afternoon, everybody. My name is Doug Glazier. I'm the Vice President of the McLaren Flint Foundation. What I'm going to tell you is a little bit about what's going on here in Flint, but I know we have a lot of listeners, a lot of people that are here from Detroit area and Lansing, and I know what I'm going to say will also touch on those topics as well about what's going on in your region. But in a nutshell, every hospital with McLaren has a foundation. I know that there is a very robust team that works at the McLaren Lansing Foundation, and there's also a foundation that raises money and supports Karmanos down in Detroit. Our job, we have a lot of things we do, but in terms of what it means for you, we raise money every day, and then we are determined to allocate that money properly. So I can tell you that raising money is key, and getting it to support your needs is absolutely critical. We make it our mission that we're not going to have an individual that, say, lives 20 minutes away in West Branch that wants to come to Flint for treatment but can't get here because of transportation problems. We will fund that situation and we'll get them here. Everybody deserves to get to the cancer center. We're going to do whatever we can to help them. So let me just back this up regarding McLaren Flint. We, as I said, wear many hats, and it would be wrong of me not to say where we are today here in Flint. We're in the conference room at the Hospitality House. And why am I bringing that up? Because the Flint Foundation is responsible for the Hospitality House. It is a beautiful facility adjacent to the Karmanos Cancer Center here in Flint. It has 32 gorgeous rooms. Many of them are suites. Why do we have these here? Because we get, on top of our cancer patients, we have stroke patients, families that come here. We just had one just yesterday, flown in. The patient was flown in from our northern hospital. The family who lives in Petoskey drove down here not knowing where are they going to stay while their loved one is in our hospital. They got a lot of stress on their minds, a lot of fear. The last thing we want to do is have them worry about where they're going to stay in Flint. We have a gorgeous facility. We just had our 10th anniversary recently. where they can stay here. We have a suggested rate of $33 a night. But if they can't pay for that, that's fine, because we raise money to support that as well. So why I'm really bringing that up, because it's regarding cancer today, is we have proton patients. Many of them could get their proton therapy sometimes for 5 to 8 weeks daily, Monday through Friday. Where are they going to stay? These folks, we've had them come from St. Clair Shores, Warren, Birmingham, Monroe, Charlotte, Lansing, and then we can go beyond the Michigan, Cleveland. We just had a patient here from Abu Dhabi. But when they're coming from the Detroit area and they're receiving treatment daily, we have right now today 4 proton patients staying here at the hospitality house, where they can be comfortable, they can focus on their treatment, have their own room, large kitchen, food is provided, services are provided, transportation's provided. Just something to think about for any of you, if you know yourself or others that might be receiving proton treatment or cancer treatment here in Flint. So somebody had mentioned a really important word, financial worry. And as I mentioned, our job is to reduce that financial worry. So we will fund many programs. We provide funds for medication. Obviously, we talked about transportation. I can tell you by the end of this month, we'll have allocated over $60,000 to support our patients who need transportation. It's becoming a major issue, but we can do it. I mentioned the hospitality house. It's here for you. We do a lot of work regarding breast cancer. Free 3D MAMs are provided. We even fund the salary of our breast cancer navigator. There are gas cards that we provide, food cards, utilities. We just had a patient recently who their power was shut down. It's a major problem right now. They're struggling to get it back on. They're struggling to make ends meet while they're getting their treatment here at Karmanos. We paid for their to get their utilities turned back on. Food expenses, another important piece. So we will do whatever we can, and we work and we take pleasure in working with our Karmanos cancer team here in Flint. The doctors know about the foundation, the staff, the nurses, all of them. We work closely and we're constantly communicating about current needs and taking care of those current needs. So what I had wanted to also say is regarding McLaren Lansing Foundation, and as I mentioned, Karmanos Foundation Detroit, those two foundations are also resources for you that is listening to this, who live in that area. Reach out to them or talk to your social worker or navigator. They will put you in touch with the foundation and get things taken care of. Like I said, that's what we're here for, and we're here for you. And with that, I hand it back over to you.
Yes, so I think we'll open it back up to questions.